What is keratoconus?
So it is a disease of the cornea. The cornea is the front kind of clear surface of the eye where the light hits initially before it starts to get focused into the eye. And it's a disease that's thought to be mostly genetic, but definitely has some environmental factors as well, where the cornea, instead of being nice and spherical, kind of like a softball, is getting abnormally shaped because there's a stretching component of the cells in the cornea, and it makes it more of like a cone shape, which is where you get the name keratoconus from. The reality is that what happens as the cornea becomes more abnormal is that it causes thinning of the cornea. And then when the light hits the cornea, it's refracted or bent in an abnormal way. So you get distortion of images and your vision is affected by it.
So how is this different from someone who just has astigmatism or something that can be corrected with a glasses prescription?
So regular astigmatism, which is very common in the general population, is when there's a slight abnormality of the shape of the cornea, but it's regular. So I would equate that to like a football versus a softball kind of thing. So you can use glasses to neutralize the difference in the slightly oblong shape of the cornea in one direction. Whereas with keratoconus, the abnormality is not near the center and can't easily be neutralized with glasses, which is why the quality of vision deteriorates more.
So if a patient is unable to correct the vision from glasses, is that one of the first signs of keratoconus? How would a patient know if they might be experiencing this?
So one thing, honestly, is also to kind of screen for it is a family history. If you know family members who've had it, you'd probably want to get checked earlier. Another thing is significant changes in your prescription. So you might actually be developing it as a young child or teenager. Oftentimes this is first seen in your teens and can progress or get worse in your early 20s and 30s. And what you'll see is a change in your prescription where the astigmatism values in your glasses are going up. So you might actually still be seeing well, but you're having significant changes in the prescription.
Does sphere ever change, or it's usually just the astigmatic value that's changing significantly?
It could be both, because as the cornea gets steeper, then the overall prescription of the inside the eye changes as well.
You had mentioned family history. How young is too young to be screened for someone who does have a family history?
So that's a great question. I think going to regular exams with an optometrist or an ophthalmologist at a young age, like I would honestly say 10 to 12 would be great to just get a screening exam. And in that situation, if you have a family history, I would recommend it with an ophthalmologist because there are new tests that are coming out that can detect keratoconus at a much earlier stage.